So good morning, good afternoon. Today we'll provide an update on testing, on schools, and on our efforts to address food security issues here in the Commonwealth. With respect to schools, in June, we stood here with the Department of Elementary and Secondary Education to announce guidelines to help get our students back to school this fall while we continue to battle COVID-19. With the support of many folks in the public health community and the pediatric community and many others in education, we unveiled a series of safety guidelines for students, teachers, and parents to help kids get back to the classroom to resume their learning and growth. We asked our school districts to come up with 3 options for in-person learning, remote learning, and a hybrid model, understanding that we must monitor public health metrics, and we've asked schools to do their best to get kids back in the classroom. Over the past few weeks, school districts have submitted plans to the department for September. Of the 371 public school districts reporting as of yesterday, more than 70% indicated they plan to offer a hybrid or fully in-person learning model. Approximately 30% proposed plans that were fully remote. We're encouraged that nearly 3/4 of the school districts are planning for at least a partial in-person learning experience for kids. Students have been away from their classrooms and their teachers and peers since March. Since then, we've learned a tremendous amount about COVID and have put together guidelines to allow for a productive and safe learning environment that adapts to the challenges that come with COVID-19. And just last week, we released a map that ranked Massachusetts town by COVID cases on a weighted scale using national and global models to indicate safe communities and communities at risk. As of last Wednesday, over 300 of our 351 cities and towns are reporting an average daily case rate of less than 4 cases per 100,000 residents or less than 5 cases total in the entire municipality. We're hopeful that these districts, which are designated white and green on our community level data map, will take this new metric into account as they make decisions about bringing students back into the classroom for in-person instruction on a go-forward basis. Today, with respect to our daily update on COVID-19 cases, testing, and hospitalizations, yesterday there were reported 213 new positive cases, which brings the statewide total to about 114,611. The 7-day average for the positive case rate is about 1.4% and has been hovering between this and 2% for the past several weeks. There are currently about 367 patients who are hospitalized for COVID-19 statewide, and 59 of those are in the ICU. As of yesterday, 4 hospitals were using surge capacity. Yesterday, the state reported that almost 15,000 new individuals were tested for COVID-19, and in total, almost 2 million tests have been administered to date. The Commonwealth is seeing a steady climb in the number of new individuals tested. Over the past week, there have been around 15,000 or more new individuals tested being reported each day. This is up compared to a 7-day average of new individuals tested per day of around 9,000 in mid-June and around 12,000 in mid-July. This is obviously good progress. We're also seeing an increase in the number of repeat tests performed on individuals, which indicates that people continue to request tests more than once over time and are taking advantage of the testing resources that we've made readily available across our state. The 7-day average for the number of total tests conducted has been above 20,000 tests for the past 2 weeks. That's up from the 7-day average for the total number of tests conducted in mid-June of around 11,000 and in mid-July of around 16,000. We're also continuing to see success in increasing testing through our Stop the Spread initiative, which currently provides free testing in 17 communities across the Commonwealth that have seen a higher prevalence of COVID-19 and previously a decrease in testing. The program began on July 10th and is now running through September 12th. As of last week, the Stop the Spread program had performed over 78,000 tests. Today we're announcing that that initiative will be further expanded this week to include 3 new communities, Salem, Holyoke, and Saugus, which will bring the total to 20 communities across Massachusetts that are part of this initiative. We continue to strengthen the COVID-19 data that we're reporting and to help inform our continued efforts to slow the spread. Last week, we unveiled an enhanced community-level data pack that categorizes each city or town in Massachusetts by risk level. This additional data will make it easier for people to understand how COVID is spreading in their communities, or not. And it will be updated each Wednesday as part of the Department of Public Health's weekly report on COVID-19. Today, we're making this data easier to access by launching an interactive map with that same data, and you can access that map at mass.gov/COVID-map. Cities and towns are shaded with the color corresponding to their risk level, and you can click on each community to see more statistics about COVID-19 transmission there. This community-level data will help the Commonwealth target efforts to support local leaders in these cities and towns where we see the greatest need. The Commonwealth is stepping up its partnerships with communities considered to be moderate or high risk to support local efforts to slow the spread there. We're working with municipal leaders on their work to enforce the reopening rules and ensure public awareness about the steps that we all need to take to stay safe. But enforcement efforts are only part of the solution to fighting the virus. People must stay vigilant and continue to do their part to keep their friends, neighbors, and families safe. The virus, as we've said before, does not stop at any one town line. And if you live in a green or no color community on this map, you must keep doing all the things you've been doing to stop the spread. We urge people to continue to use common sense and keep doing those things that we know work. Wear face coverings, maintain social distance, and practice appropriate hygiene. As people enjoy the final few weeks of summer and head out for vacations, we should all remember that COVID-19, to say it again, does not take the summer off, and neither can we. With respect to today's announcement around food security, our investments to combat food insecurity during the pandemic have been significant. And while food security has been something we've spent a lot of time working on before the pandemic, the public health emergency has resulted in increased food needs for vulnerable families and communities across Massachusetts. Additionally, the Commonwealth's agricultural and food businesses have suffered due to supply chain disruptions and in loss of key markets, restaurants, for example. And that's why we convened the Food Security Task Force this spring to address these critical issues. To date, we've announced $56 million in investments to combat urgent food insecurity, which included $35 million for a food security infrastructure grant program to provide access to fresh local food. And we've seen a great response from food producers and distributors to that program. Today, we're pleased to announce that we're awarding $3.5 million in grants as part of the second round. These grants are going to Massachusetts farmers, urban farms, seafood businesses, food banks, schools, and other organizations to help them better distribute and connect fresh, local food with the residents who need it most. The great thing about this program is it's not just a stopgap measure. The funding will also invest in building a strong and resilient local food system to help mitigate food supply and distribution disruption in Massachusetts so that the Commonwealth is prepared for any future crises. As I said, these funds are part of a broader $56 million investment that implements the recommendations of the Food Security Task Force. Other investments in that package include more support for the Healthy Incentive Program and funding for immediate relief for food banks and the distribution of emergency food boxes. We'll continue to bring every resource we can here in the Commonwealth to bear in our fight against COVID. And we'll work with the Food Security Task Force and our partners in the legislature to address food security issues going forward and to ensure that every family and individual in the Commonwealth has access to the food they need. We're also grateful for our continued collaboration with the legislature on these issues, and their support helped make many of these priorities that we've been discussing and implementing for the past few months possible. Now I want to turn it over to Secretary Sutters to talk a little bit more about the command center. Thanks.
Thank you, Governor, Secretary Theodorakis. Good afternoon. The COVID-19 pandemic has touched every corner of the Commonwealth, and we have seen how it's impacted many families and individuals' financial stability, especially for working families and our residents who have historically experienced food insecurity. Every individual, family, and community in the Commonwealth should have access to nutritious food, and we recognized early in the pandemic that we needed a nimble and focused effort was required to address this during the public health crisis. In April, the COVID-19 Command Center convened a food security task force made up of members from public and private agencies and the legislature to deliver actionable recommendations for the near term. As the governor has mentioned, we announced a $56 million investment to address food security, which includes $5 million in additional funding to expand the Healthy Incentives Program, or HIP. Earlier this month, we announced that the HIP program would add an additional 39 vendors to the program, joining 200 existing vendors. A majority are local, small-scale farmers who live in or have close ties to the communities and people they intend to serve. The Department of Transitional Assistance continues to onboard these new vendors into the program. I'd like to share a few other updates on some of our food security programs. After weeks of decline, applications for the Supplemental Nutrition Assistance Program, otherwise known as SNAP, began increasing in late July as people who were closed for the pandemic unemployment sought renewed food assistance. The number of applications at the start of August, just over 13,000, approaches levels that we had not seen since April. As of the end of last week, over 508,000 households were receiving SNAP benefits in Massachusetts. Prior to the public health crisis, the SNAP caseload was about 450,000 households, so obviously this is an increase of about 13%. Since March, DTA has also been issuing additional SNAP payments to bring families' monthly benefits up to the maximum monthly amount for those families not already receiving the maximum benefit for their household. This happened again this last August, bringing $209 million into the Commonwealth so far. As you know, the Commonwealth implemented the SNAP online purchasing in late May, and since then, $6.6 million has been spent by nearly 70,000 online grocery transactions made by SNAP recipients. DTA is working with the Executive Office of Elder Affairs, the Massachusetts Councils on Aging, and other partners to improve SNAP access, particularly among our seniors. We'll be bringing on 10 new outreach partners, most of which are councils on aging, to ensure that seniors who are eligible for SNAP sign up for the benefits. We're also partnering with the Shaw Foundation in collaboration with Project Bread to target outreach to increase participation in the Pandemic EBT program, or PEBT, in key cities. These benefits supplement the free and reduced price school meals children would have been receiving if not for school closures due to COVID. Other efforts include virtual conversations at the local level, a partnership with the Shaw Foundation and mayors in Boston, Lynn, Worcester, and Brockton to raise awareness of PEBT and encourage families to use the benefit. Additional cities will be coming online soon. These cities, why these cities? It's because they have high rates of PEBT cards having been opened, but many families had not activated the card and have used it. Across the state, we're pleased that more than 83% of PEBT cards have been activated and used, and families of more than 518,000 students have received benefits. Households receive $5.70 per child per school day for the duration of school closures, or it's about $28.50 a week. But we want all families who have the PEBT cards to access the benefit. I want to thank all of the members of the Food Security Task Force for their efforts to make sure that every person in the Commonwealth has access to nutritious food during this time. And I'd like to now turn it over to the co-chair of the Food Security Task Force, Secretary Theodorakis.
Thank you, Secretary Sutters, and thank you to you and the Governor, LG, and to the Legislature and the Food Security Task Force for their leadership on this issue. The administration has always been committed to promoting locally grown food and our local food producers, but this pandemic has highlighted some of the challenges facing our communities and our food system, and underscores the fact that hunger and food insecurity is a challenge still faced by too many residents and families across the Commonwealth. Over the course of the last several months, we've talked several times about the $36 million Food Security Infrastructure Grant Program, which aims to ensure that the food grown and caught in our state reaches all our residents, especially our most vulnerable families, while strengthening our local food system on a longer-term basis. Last month, we announced our first round of almost $3 million in grants. In our second round, being awarded today, we are awarding $3.3 million in grants to 34 recipients to fund investments in technology, equipment, increased capacity, COVID-19 safety procedures and protocols, and other assistance to help producers distribute food, particularly to underserved communities. I'd like to highlight a few of these projects receiving grants, recognizing that each of them is a great story and a great opportunity for their community. Food banks and pantries have served as an important emergency safety net for vulnerable residents throughout the pandemic. United Way of Tri-County, which has seen a 63% increase in people served at its food pantries over the course of the pandemic in Framingham, Marlborough, and Clinton, is receiving 3 grants totaling almost $500,000 to allow the expansion of their food assistance programs and to be able to accept larger volume of food donations. These grants cover changes to the loading dock, refrigeration, and a refrigerated truck, which will help the United Way increase service to the 26 food programs it reaches. The Commonwealth's agricultural and fishing industries have faced significant market disruption and economic impacts due to the pandemic. To adapt to a change in demand from restaurants and other institutions to the seafood industry, Red's Best here in Boston received a grant to purchase equipment to allow them to process and package food for distribution to grocery stores. Massachusetts has the highest proportion of direct sales in the country from our farms and producers, and this has continued to accelerate during the pandemic, but our farmers and fishermen have responded to increased demand for local fresh food options by expanding those abilities. Langwater Farm in Easton is a great example of this. They received a grant to build a year-round farm store with commercial kitchen and refrigerated storage facilities in order to sell direct to consumers throughout the year. Many of these facilities represent one of just a couple or the only source of groceries in their town. An important lifeline for vulnerable families is the Healthy Incentives Program that Secretary Sutters mentioned, or the HIP program, which allows communities to use their SNAP benefits to buy healthy, fresh produce from farms and farmers markets and receive $1 for each dollar spent on eligible fruits and vegetables, up to a monthly limit. Multiple grantees received grants that allow them to distribute more food to SNAP recipients, and this is on top of the additional funding allocated to the HIP program. Rainbow Harvest Farm in Greenfield will purchase a mobile market truck and equipment to distribute food in several communities through a mobile farmers market, which accepts these SNAP benefits. And finally, several school districts, including Northborough and Waltham Public Schools, also received grants to help provide healthy meals to students during this uncertain time. Applications for these grants continue to be evaluated on a rolling basis through September 15th. Of this year. We do expect to receive a lot of last-minute grants for that deadline, and so we would encourage producers and distributors to apply. One other item I wanted to mention is that through the work of the Food Security Task Force, we've also been working on other measures to address food system issues, and there has been this need to connect and develop a system to connect processing, storage, and distribution resources to ensure ongoing supply of food. Last week, we rolled out the Mass Grown Exchange, an online platform that helps facilitate business-to-business connections within the local food system for products and services. We've already seen strong interest in the platform with about 100 businesses and organizations already registered. I went online this morning and you can find anything from calamari and processed seafood to alpaca mittens to locally grown dairy and eggs. Though the platform will address COVID-19 disruptions to the local food system, it was designed to benefit the local food system for years to come, and we encourage all agricultural, seafood, and other food businesses looking to sell and to purchase Massachusetts products and services to check it out. I'd really like to thank the Food Security Task Force led out of the COVID-19 Command Center, and to my co-chairs, Commissioner Amy Kershaw, Jill Shaw of the Shaw Family Foundation, and Sam Phillips, the director of MEMA. Thank you, Governor.
Questions on this stuff?
Governor, we've talked a lot about the curve over the last 6 months. I haven't heard a lot about it recently.
Which curve?
The curve of COVID.
Okay.
I mean, we flattened it out. Are you feeling good now, or do you feel like we're starting to rise again? I mean, sometimes it's hard to tell with the different data points.
So one of the reasons we made the decision to start to collect and publish data on a town-by-town basis was some concerns we had that people might be looking at what had happened to the curve in Massachusetts overall, which is, 20, 25, 30% at the worst of it, down to below 2% and staying there, and thinking that that was the case everywhere in Massachusetts, and that might have had something to do with why we started to see some sort of relaxation in behavior, for lack of a better way to put it, which was something we heard from local boards of health and from mayors and other people who were saying, people are really starting to loosen up a little. And I think one of the things we were hoping to do by publishing town-by-town data was, first of all, give people some pretty current information based on national standards. That 4 per 100,000, the 8 per 100,000, 12 per 100,000, those are metrics that are used by a lot of people to talk about low risk and high risk. To make those metrics available, to publish them every 2 weeks, and to basically then say to the folks who land in the high risk and the moderate risk categories, we want to work with you to get the message out to your community that you are in fact a high risk community, a moderate risk community, and work with you to do things to actually bring your numbers down, and to be able to say to those folks that are in the green or the white, you're doing a lot of the right things, keep doing it, don't stop. And that whole issue of just having one statewide number may have actually made people a little more relaxed than maybe they should be with respect to where this thing sits from one community to another. Look, I feel very good about the work that the people at the state level and the municipal level, but more importantly, the work that's been done by the people of the Commonwealth generally since the reopening began. I mean, we started our reopening program on May 18th, and I think on May 18th, the positive test rate in Massachusetts was somewhere between 9 and 10%. And you, Jonathan, asked me a question at that press briefing where you said, what do you think you're going to hear from people? And I said, some people are going to say I'm going too fast, and some people are going to say we're going too slow. And I think because of the commitment that people made to actually play by the rules, follow the guidance, and act accordingly, we continued to see a very significant drop in our positive test rate from that point forward, even as additional parts of the economy opened up. And as I said, when we talked about putting a pause on continuing reopening 10 days or so ago, one of the main reasons for that was because we had seen what I described as sort of personal and recreational issues that we needed to deal with, and get back on the message that if you're going to be part of a gathering, especially one that's not supervised and for which there isn't guidance, you really need to pay attention to the issues around distancing and masks, and recognize and understand that, COVID is still with us. It hasn't gone away.
So you're expecting the pause to stick, and we're not going to go to part 2 of step 3 anytime soon?
I think we need to do some work to deal with the communities that are currently struggling before we go any further down the road, yeah.
Governor, on the note of recreational behavior, police busted a really large party at Encore in a private suite over the weekend. There was a DJ, they had a bar set up. The Gaming Commission is investigating. Curious, in that scenario, who's responsible, and what's your message to people who still are doing stuff like this?
Well, the Gaming Commission obviously has primary responsibility for what goes on in casinos. Just as, for all intents and purposes, mayors and city managers and city councils and select boards have primary responsibility in their communities. What we try to do is provide them with guidance in the first place, and then to buttress either with money or personnel whatever it is they're trying to do. we closed a couple of DCR pools in Lawrence over the weekend because of some concerns about possible spread associated with some lifeguards who tested positive for COVID. We've done a bunch of things with local communities around mask ambassador programs, around sort of enhanced presence on local beaches. I think from our point of view, unless it's a state police issue, more often than not, even with the state police's role in many of these communities that we've been talking to who are in the red zone, who are high-risk communities, most of our conversations with local police has been, what can the state police do to buttress what you're already up to? How can the ABCC help you if you have issues and concerns with respect to certain establishments that aren't playing by the rules associated with how restaurants are supposed to operate? I think generally you'd want to have the entity that has primary responsibility be primary, and what we want to do is support them.
The state police broke this one up. Is that what you want to see more of? Especially
Well, the state police actually has a big presence under state law at the casinos. I mean, they are the primary enforcer in those institutions under law.
Would you like to see the COVID enforcement team going out and doing more stuff like that?
I think you're going to see a lot more activity. One of the things that we've been talking to many of the red communities about is roles and responsibilities with respect to face coverings and large sort of unregulated gatherings. And I think that will be different in different communities depending upon what they think the right way to go about it is.
Governor, why not share a statewide school metric for reopening and closing schools? Why leave it up to local boards of health and the districts there?
I think what we've tried, I mean, generally speaking in Massachusetts, the rules of the road around education historically have been state set standards, locals decide what the best way to execute on state standards will be for their community. And part of the reason for why we've done it that way historically has been because we have 351 cities and towns. Many of them have different needs and different requirements and different ways of doing things. And you know, you need look no farther than every education reform bill that's been passed since the 1980s in Massachusetts has basically had the state in the role of guidance, standards, sort of general oversight and accountability, and then locals do what they think makes the most sense to deliver on whatever those standards are. Now, there are some standards that are pretty fundamental. You're supposed to go to school for 180 days a year. Teachers are supposed to teach and offer in-class education for at least 900 hours. I mean, those are pretty common standards we have in Massachusetts, and people should be expected to play to those. And as I said before, if you're in a green or a white community, it would seem to me that you should be able to come up with a plan that makes it possible for you to offer face-to-face education for your student body. And I think one of the things we're encouraged by is the fact that most communities in Massachusetts are offering some variety of in-class or hybrid approaches to educating kids at this point in time, and especially those communities that are green and white are going in that direction, which, you know, makes sense.
Interested to hear your response to the Situate superintendent who wrote to you last week, essentially talking about the guidance and the rules that are out there for school districts, and kind of saying that it was akin to being in shark-infested waters for these school districts and having chum in the water. What is your response to that?
Well, I haven't read it, so I guess I'm going to have to go with sort of a general response based on what you just pitched, and just say that I personally have had conversations with the Mass Association of School Superintendents. I've personally talked to a number of school superintendents. Jeff Riley talks to the association and to school superintendents, Commissioner Riley, literally every single day. And many of the guidance, advisory, and implementation and execution advice that we've offered to cities and towns and school districts has come directly out of the conversations that we've had with school superintendents.
Why not have Desi here today to answer some of these questions, and especially as it relates also to school sports, which there are a lot of questions out there on that?
I'm pretty sure the sports stuff is probably going to get released at some point later this week. There's been a lot of conversations between Secretary Theo Harides' shop, which oversees a number of these elements, because we do have parks, playgrounds, pools, all kinds of stuff where a lot of these activities take place, as well as conversations with the MIAA and with DESE. And I think there'll be guidance put out for after-school sports probably sometime later this week.
Governor, speaking of sports, the largest sporting event in the world is being held in Massachusetts this week. Tiger Woods and the PGA Tour down north the whole week.
Did you call that the largest sporting event in the world?
This week.
Oh, okay.
No, not the world.
I was like, wow, Super Bowl would be surprised to hear that.
That means this week. But they're going to showcase Massachusetts. It's going to be broadcast live across the world. You make an appearance at something like that, and if not, why?
I probably won't. I've been governor for 5 years. I've never gone to a single event of that kind. There's no reason for me to go or not to go that I can think of. I think as a general rule, I try to stick to what I would describe as events that relate directly to my day job when I'm out and about. And the other thing I would say, and this has just been true especially for the past 5 months or so, I don't go out much at all. And the main reason I don't go out is I'm a social distancing disaster when I do, because people do approach, they do come up, and it becomes a little complicated. And so generally speaking, if I go anywhere, it's usually someplace where we're pretty sure we can maintain distance, where we're pretty sure we can make sure we're all wearing masks, and I try not to get too close to events that have a lot of people at them, because fundamentally that creates issues sometimes.
Because it's a match, you plan to watch it.
I'll watch a little bit of it. I mean, I'm not a golfer, and believe it or not, Tom, I know that's coming as a huge surprise to you, but it's a look. That event has been a landmark event on the tour for a long time, and in fact, there have been years where the FedEx Cup has literally come down to who wins that event, and it's a great event because one of the main reasons it's a great event is because it usually gets the best golfers in the world to come. It's not when people take off, and generally speaking, in a traditional year, it would also have a giant crowd there that would be incredibly enthusiastic and have the chance to participate and enjoy it. This isn't a traditional year.
Governor, for rural schools, they face some unique challenges.
Say again?
Rural schools, they face some unique challenges, especially with Wi-Fi.
Did you say rural schools?
Yes. What is the state doing to provide them with, say they go with a hybrid model to allow students to access Wi-Fi?
Well, we put over $1 billion out for cities and towns to spend on all sorts of COVID-related activities, and in particular put about $400 million out directly to school districts to spend on COVID-related activities. And one of the reasons we made the announcement with the legislature with respect to what Chapter 70 was going to look like, which is the main education funding program we have, and the unrestricted general government aid program, was so that people could put together those funds and make decisions about what made the most sense for them for a distribution point of view. And I'm pleased to be able to say that between the federal money and the state money, it's actually a bigger dispersion of resources for education in Massachusetts than was anticipated under the original School Opportunity Act for this year. Go ahead, guys.
Governor, I wondered if I could ask Secretary Theoretes a question. Secretary, your colleague, Secretary Pollack, has forwarded 3 proposals for the throat on the I-90 Alston interchange for further environmental review. You made a statement several months back in a letter to her that you oppose any incursion into the Charles River, which seems to throw 2 of those out the window. And I wondered if you could clarify that. I've never heard you
So-
verbally talk about it.
The letter indicated that if there are alternatives that don't incur into the river, those are easier from a permitting perspective than alternatives that do go into the river.
But you're not declaring the river off limits then?
No, it just is, it's much more difficult from a permitting perspective, and if there are alternatives that don't impact the river, those would be preferable from an environmental standpoint.
Governor, a question with regard to calculating positive test rate and methodology. If I understand correctly, people who have been tested more than once, so repeat testers are now factored into what the method that's not.
One test. I heard that on the news last night. I actually texted one of the folks in our comms group and said, this is not right. Our testing protocol is one person, however many times they get tested, they get counted once.
Governor, have you
Which,
found-
by the way, makes us different than many other states that count all tests.
Can you expound on the reasoning behind why Massachusetts does the way we do it?
You know, I've spoken many times from this podium and from other places about the difficulties associated with running the show on how to handle all the issues associated with COVID on a state-by-state basis, right? And one of the ones that is particularly frustrating is how we doing relative to our peers. Because there isn't a single set of definitions that every state relies on with respect to their reporting, that would obviously have to come from the feds, there is some noise in the way people report testing data. And, you know, some states count serology tests, some states don't. Some states count all tests, some states count only tests to particular individuals. Now, it really ends up being an issue, in my view, on the margin, okay? It's not like if you look at the test trends from one state to another, that if one state is counting all tests and not just individuals tested, the numbers will be different, but they're, what, 5–10% maybe? In terms of total tests. And the same goes with the serology piece. You know, some people count the serology piece. That could be a big number. But we've tried to be pretty conservative about the way we report. So we don't count serology when we report on positive tests, and we don't count all tests. We just count individuals tested. And because we think of that as being sort of a true way of measuring positive test rates.
There's a lot of controversy about the post office right now. Would you like to weigh
Say again?
The post office, President Trump, is he slowing down the mail? The congressional delegations all talking about it today. Do you have any opinion on what's going on with mail-in ballots and voting?
So first of all, I signed the mail-in ballot voting law in Massachusetts earlier this year, and I want to commend the legislature, the Secretary of State, everybody who worked on that, because I think they did it exactly the right way, which is you get something in the mail that says, would you like a ballot? And you then have to respond to it by sending the postcard that you get to your town hall or your city hall, and then they respond. There are many states that don't do that. I actually think that's the right way to do this, and it's a big part of why I support it. I actually submitted it. I plan to vote by mail under the terms of this as it's been determined. And I think it's critically important, given that there are sort of 11 or 12 states, I think, that are voting, that are going to have big vote by mail programs in the fall, that this be done well, and that it be done on a timely basis, and it needs to be part of the way people feel about the election process generally. The other thing I'll say is, we've talked before in this room about the fact that when the pandemic struck, it pulled the ground out from under all kinds of institutions and organizations. We talk about the T, for example, which lost like 90% of its riders, okay? What no one has been talking about is the fact that one of the ways the U.S. Post Office generates revenue is business mail. In fact, I think it's the biggest part of their revenue base. Now, when COVID hit and the pandemic hit, that stuff just disappeared and created a giant problem for the post office, period. And I would hope that while the conversation is appropriately going to be about making sure that the election in the fall is straight up, has integrity, and is done on a timely basis for people who want to vote by mail. The other thing that needs to be done here is people need to understand and recognize that the pandemic took away one of the largest revenue sources the post office has, and the feds need to deal with that. I mean, that's a really important underpinning to how the USPS funds their operation. And it's not even part of the conversation at this point, but it should be.
Governor, quickly on testing, any more on rapid mobile testing for schools, which you mentioned a few weeks ago? And
Yes.
would they consider reporting average test turnaround time, which Alaska has started?
I think our average test turnaround time is, actually, that's probably not a good number. A better number would probably be some sort of median around this, because averages, if you have a big tail, I thought we did report the average turnaround time on tests. Yeah, we'll take a look at that one, and yeah, we'll have more to say on school testing, hopefully later this week.
Governor, what's the guidance for schools when it comes to if they're green, say today, but tomorrow's map they may be yellow? What would you say to them in terms of a real?
We're going to work with them to try and get them back into green. But we have over 300 communities that have been green or white for a very long time. So we'll work with them to get them back. I mean, part of the reason we asked the cities and towns across the Commonwealth to put together 3 plans was because we thought over the course of a year you might need more than one. But the other thing we've also said is, you know, even the most of the folks that talk about trends with respect to test rates and positive cases and all the rest will tell you that you need to look at 30 days worth of data before you draw conclusions about what you have. So if someone bounces from green into yellow and back into green, that's a reasonably safe place. Say again? Yeah. So the feds have issued some guidance on it. There's more guidance forthcoming. Our plan at this point in time, we did submit a letter to the feds saying that we would apply to receive funds under that program. As I said before, I don't think this is the right way to do this. I worry a lot that we're taking money from, you know, federal reimbursements for emergency services provided associated with the first 4 months of COVID under FEMA to fund this program. But if this program is there and it turns out to be the only thing that's there, I don't think Massachusetts should pass on that. So we have sent a letter to the folks at FEMA saying that we intend to apply. Oh yeah, sure, yeah. I mean, because you're basically working with a completely different set of reporting requirements and sort of rules of the road, because it's a completely different part of the federal government. It's not like it's FEMA money that's going to be run through the traditional unemployment system. It's FEMA money, so you basically need to apply and operate as if this is FEMA-based reimbursement, which has a really different set of rules than you would have under the traditional UI program.
Governor, the teachers' unions have talked a lot about upgrading ventilation systems. They say the schools are outdated. You talked about some money being funneled, $400 million and maybe $1 billion total in funds.
Yeah.
They could use that money to upgrade their ventilation.
Yeah, of course. And some have. I think the city of Worcester is actually spending $15 million on ventilation. But the one thing I would say is if you're in a community that doesn't have any COVID, you can fix your ventilation system, but I'm not really sure why you'd start there. Because you don't have any COVID in your community to begin with. I think for the communities that would really matter would be the ones that have more significant levels in the first place, and most of those at this point, I think, are operating on a remote model, which probably makes sense.
Governor, a month ago, the Patriots came out and said that they wanted to bring fans back to 20%, and you've said in the past, Lieutenant Governor, also that that was being reviewed. Where does that stand now? Obviously, they're in camp now.
Yeah, we've had conversations with them and with the Red Sox, and we basically said, look, we're focused at this point on schools, and wouldn't plan to do anything with respect to anything like that until we get much farther into the fall.
Secretary Galvin said that he's supporting litigation to protect the Postal Service. Some states are banding together. Maura Healey has said that that's a possibility. Would you support litigation to keep the post office funded, especially during this mail-in ballot?
Yeah, I don't know. I actually don't know the details of this. I'm a little uncomfortable commenting on it without knowing that, but we talk to both the Attorney General's office and the Secretary's office on a pretty regular basis, and usually the role we play, if they ask us to play one, is on a sort of amicus basis, to just give a discussion about what the implications of whatever the issue are would be, and that's our way usually of supporting those kinds of initiatives. I'm not aware that they've asked us for that. If they were to ask us, we obviously would respond.
But you think there should be some kind of support funding either from Congress or through the courts to...
Well, as I said, the biggest hit to the post office budget is the loss of business revenue. And that is something that Congress and the White House should and need to deal with. Yeah.
Governor, do you have more information on those false positives at one testing facility last week that sort of threw the numbers off?
I don't have more. Do you have more? It wasn't, I mean, we've done 2 million tests. I think it was 900 tests that we're talking about. But do you have data on this?
So it was one lab over a 3-day period. It was just over 900 total tests, of which had about 169 false positives, and it affected and a number of nursing facilities used that lab for their testing, which is what changed the numbers for Taunton and Fall River. So it was sort of concentrated in primarily, but not exclusively, long-term care testing. And so when we went back through the data, the lab, actually the Department of Public Health epidemiologist, in looking at all the data that they look at all the time, realized that the positive test rates for that 3-day period for that one lab just seemed high. And so went back and the lab stopped processing. They're still not processing any tests. And actually in an abundance of caution, it does look like it was a platform, so it was a physical, it was the plate that the specimens were on broke. But in an abundance of caution, we're actually revalidating the tests for 3 days prior to that weekend to just revalidate to make sure that it was a physical, like a broken plate and not a more structural issue. So we're pretty confident about that, and anything else would be reflected in today's Tuesday, right? Tomorrow's update.